Good evening, everyone, and thank you so much for joining us tonight. Before we get started, I'd like to read the brief disclaimer that you see on your screen, and that disclaimer is this. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to introduce myself. My name is Craig Orapello, and I will be your host tonight for the PharmAssist Virtual Learning Experience. And what is that, you may ask? Well, that's an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday night at 7 p.m. Eastern Standard Time, and it is live, and it's an interactive and medication instructional program on 3 fertility products, including an interactive Q&A throughout the program. And you may ask, how does the interactive part come into play? Well, that's where you come in, and you can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. And you can put them right into the chat or the Q&A section, and we will definitely get to all of your questions tonight. We are, as always, joined by various amazing HCPs each week from across the nation to provide you with that real-world experience, just as if you were sitting across the table from them in their clinic. And so today we are joined by Kaitlyn Endicott. So I want to thank you all for joining us. I want to thank you so much for being here and providing your expertise, Kaitlyn. And now I'm going to turn it over to you. Take it away, Kaitlyn.
Great. Thank you so much, Craig. Hello, everybody. Thank you so much for joining tonight. Again, my name is Kaitlyn. I am an IVF nurse in the Northern Virginia area. I hope that tonight's videos help you to understand and feel prepared with some different types of medications and injections that you could encounter during your treatment cycle. So tonight we will be discussing 3 different types of meds. The first one is the Gonal F RediJect pen, and then we will review the Avidrel trigger injection, and then we will end the night with progesterone and oil. After each video, we will have time for a Q&A session. So like Craig said, you can type in any questions that come to mind into the chat boxes while the videos are playing. And then of course, if you think of any throughout the program, you can type them in as they come up. Please do keep in mind that I can answer general questions about the products, but I'm unable to answer specifics such as why you're on a certain dose of medication or something like that. That's something I will have to defer to your provider. These videos are intended to make you feel more comfortable and confident with the medications when it comes time to do that first injection. And do remember that all of these live sessions and the pre-recorded shorter videos themselves will be available at the PharmAssist page for future reference. So if you're taking notes, don't worry about scribbling everything down. This will be available to you in the future. So with that being said, I think we are ready for our first medication, which is the Gonal F RediJect pen. We are ready when you are, Craig. In order to inject the Gonal F RediJect pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonal F pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So I always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, that's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen, so anywhere that you can pinch an inch of skin and the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15-30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. Yes. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you'll actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your gonal F pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the gonal F pen. This one is always a good one to start out with on the live sessions because usually it's going to be one of the first medications that patients start out with in an IVF cycle. So it's always nice to have something that's kind of pre-filled, ready to go, as you could see in the video. One thing that I just wanted to elaborate on a little bit, and I did mention it briefly, but when you are injecting and you're pushing down on the plunger, this gray part does have some give there, and there's no medication coming out when I'm doing this. You want to make sure that the red becomes flush. That's when you know the medication's being given, as well as keeping a close eye on that window to make sure your numbers go down to 0. That's 2 ways that you can make sure that you're giving the full dose. The best way is to watch the numbers go to 0, but if you're pushing and your numbers aren't moving, it's because you're not pushing hard enough. So you want to push so that the red part comes all the way back down flush. I have had some patients make that mistake in the past and they actually weren't getting any medication. So that's a way to triple check yourself. With that, do we have any questions rolling in quite yet, Craig?
Yes, we do. How's it going? All right. So just a quick reminder again that you can put your questions right into the chat or into the Q&A if you're joining us via Zoom, and we will get to any and all questions tonight, like this one, which is a great way to start it off. And the question says, what does FSH actually do in terms of my cycle?
Yes, very good question. Of course, we want to know how to do these medications, but why are we taking them, right? It's always good to know why you're on any given medication. So FSH stands for follicle stimulating hormone. So it's quite literally stimulating the growth of follicles. So in a natural menstrual cycle, our brain sends out the FSH hormone that talks to the ovaries to stimulate the growth of follicles in our ovaries. So within our ovaries are follicles, within follicles are eggs. So naturally in a menstrual cycle, each month our body picks one follicle with an egg in it to become mature, ovulate, and either fertilize for pregnancy or does not fertilize, and then you get menses. So what we're doing with this FSH is we're overriding that natural production from the brain we're skipping that step and we're giving that hormone directly, and we're giving a lot of it because we want to stimulate the growth of multiple follicles. Our goal, of course, is to get as many eggs as possible in one IVF cycle. So that's exactly what we're doing. We want to shout at those ovaries more than the regular, nice, easy talk that our brain gives to our ovaries every month. So we're really yelling, we want as many eggs as we can. And that's exactly what Gonal F is doing. It's making those follicles grow over the course of your IVF cycle. Very good question.
Perfect. Thank you so much. And I think it's always a great way to start off the program, like you said, just to get an overview of, sometimes we want to know specifically about, side effects or things like that, techniques. Other times we just really want to know, what are we doing? So this is the great place where we always say, bring those questions here so that we can get them out of the way. So by the time you're ready to give that shot, you're already a pro and you've gotten out all the questions you need, and then you can just focus on preparing for the next steps in the process. So we do have a question that's a little bit more on the other side of the spectrum here, and that is, what happens if I miss one of my shots of FSH, of Gonal F, one day? Does that mess up my entire cycle? Do I have to start over?
Yes, very good question. This is one that I get quite often. So if you miss a shot one day, first and foremost, you do want to let your clinic know. They may want to have you take an increased dose one day. Depending on the timing, they may just have you do it then. If you're just late, say you take it in the morning, you realize at night you forgot, they may just say, that's all right, do it now, continue tomorrow morning like you normally would. Or they may just say, that's okay, just continue your dose like you normally would. But it's good to let them know, because they're going to want to note if there was any, discrepancy in the protocol that they gave you, and the dosing and instructions that they gave you. So it's not going to totally break your cycle and ruin it. That's not what's going to happen. It just gave your body one day break of us yelling at the ovaries. So it might just take a minute for those follicles to grow a little bit more. Maybe they need a little bit more time than they would have had it been consistent. But depending on how your clinic wants you to handle that situation, that's something I would be sure to touch base with them and just make sure that they're aware. But yeah, it's not going to completely ruin your cycle, so don't panic. I always recommend this on almost all my lives, but a way that you can combat forgetting one of your injections is to set reminders for yourself. So everyone's on their phones nowadays. So whether that is setting an alarm daily at a certain time, or using your calendar and the alerts in your calendar. I have some patients that put sticky notes on their mirror in their bathroom and they take them off for each dose. Whatever is going to help you to not have to totally keep track of and remember to do it every single day. Use these technologies that we have around to help you remember to do them, and then you won't have to worry about if you do miss an injection at that point. Very good question.
So another thing that actually came in as seems to be a follow-up from that question, because we do know, and we will get into it as we talk about the different products here, that the specific the issue if you miss the shot for some products is much more important than other products. And then timing is also a very big thing, where like you mentioned, sometimes it's if you forgot in the morning, maybe you can take it later on as long as you check and let them know. Whereas other products, the timing is much more important. So this question comes in because you were mentioning timing, and it says, why is the timing of certain shots so important?
Yeah, very good question. So for something like FSH, like your Gonal F, we want it to be consistent. We want to be consistently talking to the ovaries throughout the cycle. And that's an effort to get a nice synchronous kind of response with the follicles that you're growing throughout the cycle. And then other injections, we are going to be very much more sensitive in terms of timing. And that's because it may be timed up with ovulation. So depending on the type of treatment cycle you're undergoing, whether it's an IUI or IVF cycle where you're ending with either an IUI procedure or an egg retrieval procedure, we do have to time out certain medications in terms of ovulation, meaning if you're doing an IUI, we want you to be ovulating when we are doing the IUI procedure, right? That's the point. So super important to take that trigger injection is usually what those time sensitive medications are called in order to be timed up with that procedure. Now, if you're undergoing IVF and your trigger injections are going to be specifically timed out with your egg retrieval, because how those trigger injections work is when those eggs are growing within the follicles in the ovaries, they actually grow. If this is your follicle, they grow attached to the wall of the follicle and they get bigger and bigger, but they're attached. What the trigger injections do, yes, they cause ovulation, but what does that mean? That means they get a little extra boost of maturity, that egg, and they also cause the egg to then be free floating in the follicle, and the follicle is fluid. If we are ending an IVF cycle with an egg retrieval, then we are timing out the procedure precisely so that we are going in and aspirating the fluid from that follicle and taking the egg with us. So it's super important for that trigger injection to be timed out right on time, because we want the egg to be free floating. We don't want it to be attached to the follicle. It may not come out in our aspiration. We also don't want it to be ovulated and have left the follicle. When we go into aspirate, take out the fluid, there's no egg. So that one is super, super precise in timing. Whereas something like your gonal F and menopur, we want it to be consistent in talking to the ovaries throughout the cycle, but it's not something that's going to completely stop ovarian activity if you're a little bit off on your timing with those. So typically, if your clinic is giving you a very specific time and they say, take it exactly this time tonight, this is when I want you to do it, it's likely one of those that is causing ovulation, and we have to time it up just right to get those eggs at egg retrieval. Very good question.
Perfect. Thank you so much for explaining that, because I do know that comes up a lot and people get, they get a little confused, or it's, you want to understand why certain products you have more leeway than others. And you obviously don't want to miss any of your shots.
No.
But you definitely want to be aware of why the timing is important, because it helps to, to make sure that you remember when you understand how important that specific shot is and why that's necessary. And we'll get into that a little bit more when we move on to our other products. But sticking with the gonal F right now, so a question a little bit more just on some of the day-to-day stuff. And this question is, what's the best way to store my pens in between injections?
Yes, this is one of my favorite topics to talk about, just because storage of the pen and expiration dates and how do I store it, those are all things that are so crucial to make sure that you're keeping that medication good and lasting as long as possible. So I'll kind of start from the top and then I'll definitely get to your question. So when you receive your medications in the mail, they're going to come in a box. Be sure to open it right away, because some of those medications are going to be required to be cooled, so refrigerated. Take those out. They'll be wrapped in like a little cooler bag, and you want to put those directly into the refrigerator. Put them in the refrigerator, not the freezer. You do not want to freeze your medications. We want to keep them at a nice, steady, cool temperature. Gonal F is one of the medications that requires refrigeration. So as long as your gonal F is in the refrigerator, has not reached room temperature, then it is good until the expiration date on the box, as long as it's unopened and cold. As soon as the gonal F hits room temperature and has not been opened, so you haven't used that first injection yet, if it reaches room temperature, from there it's good for 90 days. Once your gonal F has been used, okay, so you've done your first injection, at that point, it is good for 28 days from the day that you did that very first injection. It doesn't matter if it's in the refrigerator. It doesn't matter if it's at room temperature at that point. That's where you're at. So in between injections, it's up to you how you want to store it. If it's easier for you to keep it in the refrigerator, that's where you know it goes. that's just fine. If you want to keep it out on the countertop, let it reach room temperature, and then you know you're always grabbing that same pen until it's empty, that's totally fine too. Some patients do notice if they inject the gonal F and it's cold still from being in the refrigerator, some of them do feel a cooling sensation upon injection. Some patients do, some don't. So if that's something that you're sensitive to and you notice that and you don't like it, then I would store it at room temperature after that first use. Even when you're taking your new gonal F pen out of the refrigerator for the first time and it's cooled, and you don't want to risk kind of feeling that cooling sensation, you can take it out 20 to 30 minutes before you're planning to do your injection, let it reach room temperature, because after that first injection, it doesn't matter, right? If it's at room temperature or not, you have 28 days. So if that's something that you don't want to potentially feel that coolness, just let it sit and reach room temperature before that first injection. But really, that's up to you, how you want to store it, what works best for your flow, and making that injection just a daily habit for yourself. So if that means putting it with your toothbrush or in the refrigerator with your coffee creamer, whatever is going to be the best way for you to remember, you can do it that way, but you got 28 days from that first injection. That's a very popular question we get on this slide.
Definitely, yes. I think people want to know as much as they want to know how a product works or what it does or any of that. They just want to know the little things that can make the process simple from beginning to end. And these are the types of things. Where do you store it? How do you remind yourself? Things like that. So feel free to keep bringing any and all of those questions to the show tonight. So we do have this question that I know you've answered this a number of times. This comes up quite a bit. Very popular question. And it is one of the things that people just want to make sure you get right, because you don't want to get stuck at the moment of truth when you're giving the shot and you're not aware, or you don't remember the answer. And that question is, what do I do if I don't have enough medication left in my pen to get through a full shot?
Yes. So if you are, and I have a pen here. So if you're looking at your pen, now mine has quite a bit left. Okay. But if your plunger is way up here and you do not have enough in there to get your full dose, you have a couple of options here. You can discard the pen, put it in your sharps, get rid of it, open a new one, dial up your dose like you normally would, do your injection and move on. Now, we have a way of getting that medication out that's kind of left over. We call it the overfill. There's a little bit extra in each of these pens than the units that they come in. So we don't want to throw that out. That's money wasted, right? We can utilize that. So what you will do is it will require you to do 2 injections for that dose, but it allows you to use up all of the medication completely out of the pen. So what you'll do is you will prep the pen just like you normally would, put on your needle cap, and dial up to your dose like you normally would. Okay, don't worry about how much is in the chamber right now. Dial up that dose. So if you're at 150, you're going to go up to 150, and then you are going to inject just like you normally would, push on your plunger, and then it's going to stop before your numbers reach 0. Okay. And you're going to look at your plunger, and your plunger is going to be totally flush up here. No liquid left in the chamber. You've gotten all of that overfill out. At that point, you can take the pen out, get rid of that needle, and look at the number that is left in the pen. Whatever number is left in your window is what you are going to dial up on a new gonal F pen that you'll open. So it does the math for you. Whatever's left in this window, open your new pen, dial up exactly to this number, do your injection like you normally would, and you've gotten the full dose. If you start finding yourself doing math in your head, stop yourself right there. You're doing it wrong. The pen does everything for you. So even bigger benefit of the gonal F. Not only is it pre-fill, but it does math. So that's the number you're dialing up in your new pen. Do your dose, all done. Hold on to that pen for further doses. And then you can do the same thing with all of your pens, just always utilizing that overfill. Now that's if you don't mind doing 2 injections, like I said. I have some patients that just really do not want to do 2. In that case, that's fine. You can discard that pen, but if you want to utilize every little last drop, that's how you're going to do it.
Thank you so much. And yeah, I know for at least definitely for me, having a a smartphone in my pocket, I never want to do math. So I love anything that does the math for me. That's great. So it's good to know that it's already done there for you, and you just got to pull up the next pen and dial it up, and you're good to go. So why waste it, right? If you can figure out the easiest way to do it, make it easy for yourself and save some money. So that's great. Perfect. So it does look like as of right now, we are all caught up with our questions. So as always, I just want to give people like 30 seconds in case somebody just thought of a great question based on your answer you just gave. But as always, we remind people there is no rush, that if you think of a question or it comes up later on, we obviously can answer questions about GONAL-f even if we move on. Or if you have a more kind of generalized question, feel free. But I will throw it back over to you, Kaitlyn, as we give people another like 30 seconds or so if they have any last questions, if there's anything you want to share with the room.
Perfect. So one more thing as well, I know in the video for subcutaneous injections, I mentioned that you can do the injection in the belly or kind of the outer thigh where you can pinch an inch. I do have some patients that do it on the back of their arm as well. So pinching the back of the arm, and you can do the shots there as well. I have some patients that just choose one of those 3 sites and stick with it. I have some that rotate all of the sites. I usually recommend starting with the belly. It seems to be the easiest kind of logistically and angles and all that kind of thing. And even within each site, you can rotate around. So with the belly, I usually say the 2 to 3 inches out from the belly button is fair game and all around. So you can kind of work it like a clock, start on one side and just kind of work your way around. Same with the outer thighs. You can start at the top, pinching an inch and working your way down, and then rotating sides on the thighs and the arms as well, just to keep the skin from getting too tender from doing the injections in the same exact spot every day. It would get tender if you did that. So rotating throughout the sites themselves and then from site to site can help with any tenderness that you might experience. And with that, any other questions rolling in, Craig?
I think we are all caught up right now. So as before, feel free. You can add your questions at any point in time. But with that being said, I think we're ready to move on to the next product whenever you are.
Perfect. So next up, we will be talking about Avidro. So this is a trigger injection. So when I was talking about specific timing and ovulation and that sort of thing, this is one of the ones we're talking about. So it is given the same way as your GONAL-f pen. It's a subcutaneous injection. So any of those 3 sites that I just reviewed with you are fair game for this one. It's pre-filled, similar to GONAL-f, except you're not dialing anything up. It's just ready to go. So that's another plus about this one. But we will go ahead and dive into the details of the video. Now we're going to review how to do an Avidro subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies. You'll need your injection. So you can see it here. You also need your alcohol prep pad, and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Avidrel trigger injection. Okay, so like I said, that one's nice. It's pre-filled, ready to go. The needle's on it. It's even really less work than your Gonalef. So if you're using that at the end of a cycle that you've used some of the other medications that, fertility has to offer prior, that's going to be a cakewalk by the time you get there. It only just requires that skin site prep and physically doing the injection, no mixing, you're good to go. So that's usually one that patients feel pretty confident in by the time they get to that part of the cycle. They may or may not have done other injections up till that point, but the fact that it's pretty much, easy in terms of no mixing and it's ready, that's one that is usually a good starter as well. With that, do we have any questions rolling in quite yet?
Yes, we do. So this one just came in, and I know you've talked about the idea of missing shots and the timing and so forth. And this obviously is one of those ones that's much more important about that. And so this question comes in just for a little bit more clarification, saying how much wiggle room do I actually have with missing the shot before I need to notify my clinic? Is it seconds, minutes, an hour, etc.?
Yeah. So this is definitely one that I would confirm with your clinic, as each one may do it differently. And it's definitely a question you want to ask at the beginning of your cycle, sooner rather than later, so that you're not calling at the 11th hour, determining if you've done it too late or what they want you to do. So this is a good question to ask at the very beginning of your cycle. Make sure you're totally prepared for any circumstances you may run into. But generally, I would say that if you're more than like 10 to 20 minutes late, I would definitely check in with them, confirm that they still want you to take it right then. They may want you to do it at that point and say, you're good, no problem. We'll move forward with the procedure as planned. Or they may say, still take it now. We're just going to bump your procedure back a little bit. Or they may say, you know what, go ahead and wait. I'm going to give you a new time to take it, and here's a new time for your procedure. So everything is planned out very precisely. However, there is some small little wiggle room with these. So in the case that you're more than like 10, 20 minutes late, I would definitely check in with them, make sure that they don't want to kind of reschedule things and push things a little bit, depending on, time of day that your procedure has already been planned for.
Perfect. Thank you. Yeah, I know there's, we get it all the time. So it's obviously a common, it could create some nerves just when you know about that tight wiggle room. And it's good to know that it's not seconds, but also definitely not like half an hour that you really want to push it. So people kind of can prepare for that. And it brings us back to your previous point that use any one of the number of things that you're at your disposal to remind yourself so that you're not in the situation where you have to worry about, am I still within that wiggle room? Because that can probably alleviate quite a bit of stress on that day. But that's what this program's for. So you can ask that today, so it doesn't happen tomorrow. So great to hear. Let's see. So more questions coming in. So talking about the trigger shots, this one says, what is the difference between Avidrel and the other HCGs that are available? Those tend to be mentioned interchangeably on the web, but Avidrel is not.
Yes, so this is a very common question that I get, mainly because, like you said, they're kind of used interchangeably. Also, depending on your insurance coverage, sometimes they prefer one or the other, and your provider wants you to use the opposite one or whatever the case may be. So typically in the fertility world, the big thing that will determine if you are using Avidrel versus one of the other HCG brands is going to be the dosage that your provider wants you to take. So your Avidrel dose is much less compared to some of the other brands of HCG that can be prepared as much as 10,000 units per vial. So that's probably going to be your main deciding factor between the two. I believe there's a small difference in how they're actually made, but for the purpose of fertility, they're kind of doing the same thing there. So I think Avidril is used through like recombinant DNA, whereas the other HCG brands are urinary HCG. So a little bit different in the makeup, but for the purpose of fertility, most often that's not going to be a deciding factor. It's going to be the dose and pricing and things like that, typically that are going to make the decision for you, unless your provider has a very strong preference for Avidril versus the other HCGs or a certain HCG brand, then that would be something, of course, that would take precedent over, over the other options. Very good question.
And actually, that's one of the things just where Mandel's can help as well, because quite often we'll have a lot of that background information to know if a clinic is like, hey, I'm writing this one, but feel free to obviously check their insurance, see what's cheaper, what's the best, what's more affordable for the patient. And then you can allow for some transition between medications there versus other clinics that are like, no, when I write it, this is the one I want because this is the one I use, or this is the one I feel most comfortable with, or I want this patient on. And so there is a lot of communication back behind the scenes between the clinic and the pharmacy to make sure that we're meeting those needs for the patient there. So it's a great thing to bring up, and helpful for the patients to know as well, that we're there to support them kind of as a partnership team between the three of us, the clinic, the patient, and the pharmacy. So awesome. All right, so let's see some other questions coming in here. So this one comes up often, and I love this question because a lot of times this is probably because somebody saw it on TV or in a movie, but we always like to make sure that we get this out so that you don't get nervous.
I think I know what one this is.
Are bubbles in my injection dangerous? How should I handle them so nothing goes wrong?
Yes. This is the most common question I think I get both here and at work. So the air bubbles and injections have been amped up so much in Hollywood and the movies and what we see on TV, like you said, Craig. So realistically, the injections that we are doing, these subcutaneous injections, small little air bubbles there are not going to hurt anything. We are not putting these needles directly into veins with big quantity of air from a syringe just right into the vein. That's where you're at risk with a massive amount of air going directly into the vein. These injections are going into that fatty tissue. So the little air bubbles are not going to hurt anything here. You could have a decent amount of air go under the fatty tissue. It might be a little itchy or uncomfortable and cause a little bit of a bubble, but it's not going to hurt anything. And that would be a decent amount of air. But like the small little air bubbles that you see kind of around the bottom of the plunger. So sometimes you'll see little ones right around the bottom here. Those are not going to hurt anything. Sometimes there's small ones. You can even see one right there. That won't hurt anything. But if you want to just feel better about it, you can always tap it. They should go up to the top, and then you can prime the needle by taking off the cap, pushing up that plunger, and you'll see the little liquid bubbles kind of fall to the side of the needle. That's how you know you're flush with fluid from bottom to top, but really it's not necessary. Those tiny little ones are not going to hurt anything in that fatty tissue. So rest assured there.
That's great. Well, it's good to know that surprisingly, your information about your health and treatment throughout your cycle is not going to be best delivered via daytime TV or
No.
Hollywood. It's good to know. But it's a question that comes up a lot, so we know it is definitely something that is important, and we do want to make sure that we get to it and can answer those questions for you. So thank you so much, Kaitlyn, for that one. This question just popped up that says, this seems pretty simple, everything that you're talking about, Kaitlyn, walking through, but when it comes down to actually giving the injection and I have questions, can I call someone for assistance?
Yeah. So, depending on what time of day you're doing the injection, I would check with your clinic, see if they have an on-call line, if it's after hours. Otherwise, I'm sure that your clinical team would be happy and able to answer, any questions you have. You can also contact the pharmacy. They are a great resource for questions that you have about the injection. So that's something that I would look into ahead of time. You can always ask your clinic, generally, are you able to tell me a general time frame of when these are usually taken? Are they at night? Are they during the business day? What can I expect? And usually we can give you some sort of estimate. Generally they're from this time to this time. And if that's after hours, you can inquire about an on-call, or the pharmacy may be open for you to contact them as well.
And one of the things that we mentioned is obviously these videos are all, like you said, Kaitlyn, are all available for you on demand, not just the full video that we're going through right now with the Q&A included, but also the miniature kind of bite-sized product videos. And they'll be available all the time, so that if it is, after hours and you just want to, like, hey, I just want to remember what, Kaitlyn had mentioned about XYZ, or how to do this, or, I do see a bubble and I just want to tap it away. Let me see what she said. You can pull these up and watch them literally seconds before you're about to give your shot, and make sure that you have those questions answered. But of course, if you do need somebody that you will be able to reach, and be able to get questions answered. So it's great to know. And again, hopefully you can get most of that stuff out of the way today, so you don't have to worry about it when you're about to give your shot. But obviously, you will not be the first person to ask the question, whatever that question may be. So always know that somebody was there to help you out, whether on the pharmacy side or at the clinic side as well. So
Absolutely.
that, and speaking of, you will not be the first person to ever have this story. This question comes in, and I'm actually excited to hear what your answer is to this. And it says, based on all that you've talked about with the timing and the importance of, giving yourself that shot right in time, what is the worst situation, or most potentially fraught situation that you have had regarding a patient missing their trigger shot and trying to figure something out, and try to make things work, with all that going on?
Yeah, that's a good one. So personally, I haven't had a lot of patients like completely miss their trigger shot altogether. So I'm very thankful for that. If anything, I've had patients that have done it at the wrong time or late, something like that. And in those cases, we just move the procedure to match, the original timing that we had already calculated before. We just moved things around. I will say, I think I had one patient that had taken their trigger shot an hour and a half late one time for an egg retrieval, and didn't actually tell us until after the procedure was done. And we got, the amount of eggs we expected, and everything was totally fine. But had they told us ahead of time that they had taken it that late, we definitely would have moved the procedure to match that timing, because that's a larger amount of time. So we would have waited to do it a little bit later. But that actually ended up working out fine. That doesn't mean it's okay to do that. Still tell your clinic if you're that late doing your injection. But it just so happened that kind of worked out. But typically, if I see this, we would just move things around to meet it. But that's probably the craziest story I have, which I guess is a good thing. My patients are doing all of their injections on time, and I love that. So
Definitely. No, that's great. I mean, it's good to know that things are working, right? When
yeah,
that is the craziest, people are, getting the information that they need, and then making sure they take it into account. And that the reason why we were saying before that is such a great question is because we want people to know that any question that you have or situation that you come across, you're not alone. This is not the first time it's happened. You're not going to be the first person asking this question or bringing up this situation to your clinic, because things happen, and we get that. And so that's why this program is kind of put together, so that you can ask the questions here and really get that stuff out of the way, so you're ready for your shot. But that is a great question, and that was a great answer. It's good to know whatever you're doing, Kaitlyn, it's working.
right on it.
So that's perfect. Well, with all that said, it looks like we have wrapped up questions on Avidril for now. As before, give another 30 seconds for anyone who's trying to get that question in, and I'll throw it back over to you before we get ready to move on to our third and final product of the night.
Excellent. So, like we've said a few times tonight, using those smartphones and technology to help yourself remember when to do these injections is great. But when it comes down to doing the trigger injections, the ones that are super, super time sensitive, set your alarm for 10 to 15 minutes beforehand. That way you can take out the medication, prep anything you need to. That way, when it comes time to actually doing the injection, everything's all set and ready to go. If you wait and have your alarm go off at the exact moment you're supposed to do it and you haven't even taken the medication out of the box and prepped the skin site, it's going to heighten the anxiety and the pressure to make you feel rushed, and you would be more at risk for making a mistake with the medication. So just giving yourself plenty of time to get everything ready, set up, ready to go, so that when the clock strikes that time, you're ready to go. And in that way too, if you do have questions that you think of, you have some buffer room to reach out or refer to these videos online to refresh your memory of how to do them. So it's not something you're trying to squeeze in within 30 seconds of your alarm going off and trying to do the injection. So that's just another tip in terms of timing to make sure you're doing your injection at just the right time.
Perfect. Okay. Well, we are all caught up. So no further questions. So we are ready to move on whenever you are.
Perfect. So our last product for tonight is the progesterone and oil injections. This is one that I get a lot of questions about. So I hope that these videos and our conversation will help to kind of ease the nerves that come along with this injection. I think that this one can be intimidating because of the length of time that patients are usually on them. It's weeks. So it can be a little bit intimidating compared to some of the other products. So we are ready when you are, Craig. Now I'm going to show you how to do a progesterone and oil intramuscular injection. First, I recommend collecting all the supplies that you need to do the injection. So first and foremost, of course, you need your progesterone and oil medication. So collect that vial. Next, you will need a syringe and needle. Typically, it's a 3 ml syringe that's used. A lot of times they will come with needles attached onto them. For the sake of this video, my practice uses the 22 gauge needle to inject and an 18 gauge needle to mix. I recommend talking to your provider about what they prefer you do for your treatment. So here I have the 3 ml syringe with a 22 gauge 1.5 inch needle. So then I also have a 1 inch 18 gauge needle to mix. You will also need your alcohol prep pad. So at this point, go ahead and take the cap off of your progesterone and oil. It just snaps off here. You'll see the rubber stopper on top. Then open up your syringe that has the needle attached. It'll peel open like a banana peel. And then you can open up your needle that you'll use to mix. Now, if your provider wants you to use the same needle to mix and administer, you won't need to do this step. So that second needle opens up like a banana peel as well. I recommend avoiding touching the top of this cap here and keeping that sterile. Then if you twist, your other needle will come off. You can set that down to use later. Then this needle will twist on. If you twist to the right, then you can remove the cap. And again, at my practice, we typically have doses of 1 ml. So for the sake of the video, that's what I'm going to use, but I would confirm this with your healthcare provider. So I recommend drawing back to the number that you will use to administer. And what I mean by that is if I'm using 1 ml, I'm drawing back right now 1 ml of air. So you can see my plunger is right at that 1 ml mark. Then you will take your vial and the needle goes right into that rubber stopper. Then push your air in, flip the vial over, pull your needle down slightly to be sure it's in the liquid, and pull back, and you'll see the medication pull back into your syringe. And it is oil, so it's a little thicker, so it might take a little bit of help of you pulling pulling down on the syringe. Now, if you have some air, that's okay. You can push back up and start over. That's perfectly fine. So like I said, I'm using 1 ml for this video. So I have 1 ml of the oil here. Take this out. So now I'm ready to administer. I do not recommend administering an intramuscular injection with an 18 gauge needle, which is why I saved my 22 gauge needle here. So this will twist off, put it directly into your sharp spin. No need to recap it. And you'll twist on your needle to inject. So now we are ready. It's time to prep our injection site. For the sake of the video, this is going to be my skin and my muscle. When you're doing it at home, I would confirm with your healthcare provider if they have a preference of a site for intramuscular injections. I typically recommend using the upper outer quadrant of the buttocks, so it's almost like your hip area to do the injection. So once you have chosen your injection site, open your alcohol prep pad, clean the site with alcohol, let it dry completely. Take the cap off of your syringe, and then you're actually going to kind of pull the skin taut, and then you will inject quickly, fast like a dart at 90 degrees. Fast there, all the way to the hub, and then press the oil in. Now it is thick, so it can take a moment to go in. Typically in skin, it's a little quicker than my cube here. Once the injection is in, you take your needle out. There might be a little bit of oil that comes out of the site, and that's okay. You can just wipe it up with some sterile gauze, and then you can recap your needle, put it into your sharps container. You're done. Now, one thing I like to mention with the progesterone and oil, especially because a lot of times when patients are taking this, it's for extended periods of time, weeks on end. So the oil can actually kind of collect if you're not active and moving after you do the injection. So the worst thing you can do is go back to bed, wake up in the morning, do the injection, go back to bed and let it sit. I recommend massaging the area. You can take like a tennis ball or a lacrosse ball and kind of knead it on the area as well. Heat can help disperse the oil as well. Just if you use the heating pad, be very, very careful that you pay attention, only use it for small amounts of time. And then being active, so walking around, going for a walk, things like that can help to disperse the oil into the muscle as well. Okay, so that was the progesterone and oil. Like I said, this one can be intimidating. A lot of the reason is the length of time patients are on it, and also that it's an intramuscular injection. So different than the previous 2 products we reviewed that are smaller needles that go in the fatty tissue. This one goes into the muscles. So very similar to like a flu shot type size needle. Now, like I said, I usually recommend the kind of hip area. What I usually do for my patients, and I'm sure your clinical team would be open to doing this as well, is if they don't mind have a little bit of a Sharpie mark on them, I'll actually draw targets on either side of their hips for them so that they at least know the general area of where to do it. They can stay in those targets. It's one less thing that you have to worry about with the injection. You don't have to figure out the location. You just have to physically do the injection at that point. Another good tip for determining the best area to do it in that glute muscle is if you imagine that you have a pair of blue jeans on and you put your hands in your pockets, where your thumb falls and kind of hits that upper outer corner of the pocket square up there, that's where you're going to want to do the injection. So that's another good tip if you don't have somebody that can draw, where you should do it. So yes, with that, I'm sure we have questions about this one. This is one that is usually more unknown compared to the rest of the products.
Yes, definitely. We definitely have a couple of questions have already come in, and I expect some more to come as we go through. But this question comes in just about, I guess, the oil part of progesterone and oil, and you mentioned about that being a part of it. And so it says, how is progesterone and oil different than other types of progesterone that I've heard about, such as suppositories, pills, etc.?
Yes, so it's just a different route to deliver that medication. Now, with that being said, this progesterone and oil, I call it liquid gold because it truly is. That is how good it is. The other different forms of progesterone, don't usually absorb the same way and are able to truly do the same job that progesterone and oil does. And so usually progesterone and oil is used when you are undergoing like a medicated transfer cycle, meaning that your clinic is totally taking hold of the cycle itself and the hormones involved. So they are not watching your natural cycle, waiting for a follicle to develop and then, use the progesterone that is made from a follicle. When a follicle ovulates, it forms a corpus luteum, and that corpus luteum produces progesterone, and you need progesterone to sustain a pregnancy. The placenta will take over progesterone production around 8 weeks or so gestation. So in a natural conception, that corpus luteum that forms after ovulation will stick around until the placenta takes over that production. Now, if your clinic is totally taking control and doing a fully medicated transfer cycle, then we are not waiting for that follicle. We are not causing a corpus luteum to be formed. So we have to take over that production ourselves. And that form is usually going to be our gold standard liquid gold, progesterone, and oil. And then some clinics in their protocol will also add in suppositories or pills in addition for additional supplementation. Other times, though, not only is this liquid gold, but sometimes I have patients who do that natural cycle, and we do have a corpus luteum that is producing its own progesterone. We like to supplement with a suppository, but they just can't imagine doing a vaginal suppository, and that's totally fine too. And they would rather opt for the intramuscular injection. So sometimes you have the very opposite, where suppository or pills may be hard on the stomach or something like that patients would opt for progesterone and oil. So depending on your protocol, there might be some substitutions here and there, but really progesterone and oil is going to be your gold standard liquid gold if you do not have a corpus luteum that is supporting that pregnancy in the early weeks of gestation until the placenta can take over.
Perfect. Thank you very much. I think sometimes it could be a little bit confusing just because you hear about a bunch of different products, especially if you're like, if you've gone on the web or you've looked on different blogs to find information. So it's good to have that information to kind of let people know what they're looking at. So speaking of that and the oil part of it that we were just that we had mentioned, this question just came in and it says it's definitely harder to inject than other medications because of the oil's thickness. Why does it need to be mixed in oil anyway? So you touched a little bit on that, but just to give a little bit more information on the oil aspect of it.
Yeah, absolutely. So progesterone that is used in that is actually powder on its own. And of course, we can't just inject a powder. We have to mix that with something. And unfortunately, that powder is not water soluble. So it can't dissolve properly in water. So it has to be mixed with oil for the administration. So that would be $1 million idea if somebody can find a powder that can be mixed with water appropriately and do the same thing, because it really is, that good. But rotating sites and, being active, increasing blood flow, that sort of thing can definitely make these injections more tolerable and less tender over time. Like I mentioned in the video, increasing that blood flow really helps to disperse that oil after injection.
Great. Thank you. I know that's it's always people want to know why, especially with that one, I think specifically because it is different. It's the one that takes a little bit more preparation and understanding what you're doing and how to do it. And then obviously also just the presentation itself. So thank you for making that very easy. And I'm going to get back to work in the background trying to come up with my $1 million idea.
There we go.
We'll see what happens. All right. So this one with this as the intramuscular shot and some of the side effects that you referred to that can happen when you're giving yourself that shot. the question comes in, is there anything I can do in advance to prevent welts, rashes, or injection site reactions from this shot? Or is it all just, kind of treat after the fact?
Most times it's going to be treating as you notice it. Now, once you notice, or if you even notice, some patients don't notice at all the kind of rash or irritation at the injection site. So you can use a over-the-counter hydrocortisone cream on there. That's typically fine to take. Also, some patients can notice some itching from it. And as long as it's localized, you can do Benadryl for that most often as well. Confirm all of that with your healthcare provider depending on where you are in treatment, but usually those things are fine to take to help with that over the counter. Like I said, rotating sides can help. So usually this is something that's daily or every other day or whatever it may be, but every other injection, rotating sides of the hips can help. And then, like I said in the video, doing it in the morning if you can, or if your shots are to be taken in the evening, make sure you're not doing it right before you lay down for bed. That's going to cause that oil to collect more than it would if you were active and up and moving around. You can use massage, or some people use like a lacrosse ball to kind of massage out the area. Applying heat can help as well. So a heating pad, just be mindful if you're doing that you're not leaving that heating pad on for too long. We also don't want to, burn your skin. So be mindful of that. And, if you're noticing a reaction at the site, that's generally common. However, if you see that rash becomes more widespread, or you're having trouble breathing, swallowing, those are signs of a more severe allergic reaction that do require immediate medical attention. So that is something that if your clinic's open, call them immediately, go to the ER, etc. That's something that needs to be addressed right away.
Perfect. Thank you very much. And one thing there's one question that just did come in, and I'll actually take it for you, Kaitlyn, unless obviously if there's anything you want to add. But
Sure.
The question came in that can you guys please go over and explain the Menopur of mixing of Menopur again? I think I may have missed it. And I was just going to let you know you did not miss it, because we did not actually do that tonight. But it is one of our products that is part of the PharmAssist program. So if you go to mymandelsPharmacy.com/PharmAssist, you can find all of the different videos, and there's multiple different Menopur videos, Kaitlyn's, as well as the rest of the nurses as part of the PharmAssist program. So you can check out what's going on over there. And maybe we'll check it out next Monday night. So you can join us again next Monday at 7 p.m. Eastern Standard Time, and perhaps Menopur will be one of them. So just wanted to get that out of the way, unless there's anything
Perfect.
you had. Okay, perfect. With that being said, it looks like we're all caught up. So as always, I'll say again to people now, we'll open it up to any one of the three products we talked about. If you have any more general questions about your cycle, you can feel free to bring those up now. And then otherwise, we'll get ready to get started wrapping this thing up tonight.
Perfect. One other thing I typically like to mention with the progesterone and oil injections as well is, I kind of went over the counter things and home remedies in terms of massage, heat, increasing blood flow. But something that you can talk to your clinic about is using some sort of numbing, numbing patch or ointment, something like that. So a common one is the Sanera patch. That is a numbing patch that you just apply 20 to 30 minutes before you're set to do the injection. Not only does it numb that area and the tissue, but it also heats up as part of the mechanism of action to make it work. So you also get a little bit of heat there with it. So like I said, heat can help that oil disperse. So that's kind of an added benefit with the Sanera. We actually have videos on that as well on the PharmAssist page. If you want to know more about that, we have some pre-recorded ones on there. That's pretty easy, but that does require a prescription from your clinic. So that's something you can, request from them as well to help with the intramuscular injections.
Sounds good. Well, I do believe we are all caught up. There are no new questions. So I will turn it back over to you, Kaitlyn, to begin just wrapping up the program tonight.
Perfect. Well, thank you all so much for taking a time out of your Monday evening and joining me tonight. I hope that not only the videos, but the discussion and the elaboration and the tips and tricks that I try to give during these live sessions really do make you feel comfortable and confident with the injections. I promise after you do that first one, you're going to be like, I got this. I'm a pro. Just another reminder is always that these videos are included on the PharmAssist page, including tonight's live session. So you can always go back and review anything that maybe you missed or something that you want to hear again. Before you do the injections, I usually tell my patients, pull them up before your first day or two on them, review it quickly, and then you can do the injection right after, so it's fresh in your head. So again, thank you all so much for joining me tonight. I'm going to pass it back over to Craig to close things out.
Well, most importantly, right out of the gate, I just want to say thank you so much, Kaitlyn, for all of your time and expertise tonight and for your great stories. We really do appreciate it. And you are part of the reason why the PharmAssist program is so valuable, because you get to hear from a real world, highly talented nurse who can share some of this information with you. So thank you. And thank all of you at home who have joined us, whether you're on Zoom or on Facebook Live. And if you shared any questions or you just soaked in all the information and let it kind of wash over you, we hope you were able to learn something tonight. We hope you had a good time, and we look forward to seeing you come back to another one of these programs again. And because they tell me that repetition leads to retention, I will say it one more time, just like Kaitlyn did. All these videos, whether the full virtual learning experience or the individual products, are all available. You can find them on our YouTube page. You can find them on our Facebook page, where you might be watching this right now. And you can also find them on mymandelspharmacy.com/PharmAssist. You can watch the whole thing, even maybe the one where you asked a question and you want to share it with all your friends and say, that was my question. I asked that. I'm on the internet now. You can do that. So we hope to see you all here again next Monday night, 7 p.m. Eastern Standard Time. And the number one thing is, please, if you got something out of this, please share this program, whether it's with a family member, a friend, a colleague, a random stranger that you bump into at Target. Any of these things are great people to share the program with, because that's the way other people can benefit from it, just like you did. So thanks again for joining us. Thank you, Kaitlyn, for hosting and being here as our special guest. And I want to tell everyone, have a great night, and we'll see you again next Monday night.